Coming to the questions, the first is a person who has undergone for oral glucose tolerance test OGTT has fasting glucose 131, 2-hour glucose after 75 gram glucose load is 204. So what is the patient status? So options are here. So let's see, if fasting is greater than 126 and PP is greater than 200, we can call it purely diabetic. So the option is diabetes mellitus. Let's highlight it. Second question, a doctor called to lab to ask which test is available for long-term glycemic control check. So which test will you suggest? Here the good option is HbA1c because it checks the glycemic status for 3 months and it relies on lifespan of hemoglobin within RBC. So for long-term glycemic control we have HbA1c. Another question, calculate LDL from following report. Total cholesterol, HDL cholesterol and TG is here, and we can calculate it by Friedewald equation. In Friedewald equation we have formula total cholesterol 240 minus HDL 35 minus TG by 5, that means 200 divided by 5, that is 40. So 165 is the answer. So let's highlight it. Another question, which of the following tests is conducted to diagnose cystic fibrosis? Cystic fibrosis is the disease which affects the cell that makes mucus, sweat and digestive juice. So sweat is here. Sweat chloride test is done for the diagnosis of cystic fibrosis. Another question, which of the following should be monitored during insulin therapy? So here the potassium is the answer because potassium should be monitored because the injection of insulin causes influx of potassium inside the cell, causing potassium level to decrease. So during insulin therapy, potassium should be monitored. Another question, a 22-year female visited to hospital. The physician ordered TFT and this is the report. So what is the diagnosis? In this report, T3 is within normal range, T4 is within the range and TSH is increased. That means T3, T4 normal, TSH get increased. So the diagnosis is subclinical hypothyroidism. And if untreated, later it will be converted to the overt or true hypothyroidism. Another question is, cornicterus is related to which body part? So answer is the brain, and it is related to brain, typically seen in infant due to excess bilirubin. Cornicterus is related to excess bilirubin. Best test for acute pancreatitis. So lipase is the answer because it is an enzyme produced by pancreas which helps in fat digestion normally, but in acute pancreatitis it gets increased. So lipase is the answer. The enzyme expressed by most tissue of the body. The answer is LDH, lactate dehydrogenase, because it is the enzyme expressed by most of the tissue and it is the marker of common injury also. So LDH is the answer. Another question, during detection of CKMB by immunoinhibition method, which subunit is inactivated. So in immunoinhibition method, the antibody is directed against M subunit of CKMB. Okay, M subunit of CKMB. Then the activity of B subunit is measured, which is then multiplied by 2 to get the result. So the M subunit is activated during the estimation. So answer is this first one. Another question, which of the following is first step during 24-hour urine protein analysis? So the answer is measure the total volume, and that volume is needed to calculate 24-hour value later. So this is the first step during 24-hour urine estimation. Another question, which lipoprotein lipase is known as pre-beta lipoprotein? So here answer is VLDL. VLDL is pre-beta lipoprotein, and it is called pre-beta due to its migration pattern in the electrophoresis. So another question, which of the following is the marker of congestive heart failure? So here NT-proBNP, N-terminal pro-B type natriuretic peptide is the correct answer, because this is the marker of heart failure and it indicates the cardiac load. Okay, so this is the marker of heart failure. Another question is, a patient is admitted to an emergency of hospital with complaint of organophosphorus poisoning. Which of the following enzyme is inhibited? So by organophosphorus poisoning, cholinesterase will be inhibited, okay, which leads to the excess acetylcholine in body. So organophosphorus poisoning cause inhibition of cholinesterase enzyme at the knob ending. Final question, hook effect during estimation of tumor marker by immunoassay can be minimized by? Okay, hook effect appear due to high concentration of analyte in the sample. So it can be minimized by the serial dilution method. Okay, hook effect can be corrected by dilution. So B, dilution of specimen is the correct answer.